My name is Helena, and I'm an enrollment coordinator with Bicycle Health. At Bicycle, we're committed to helping folks beat opioid addiction by providing full-service treatment that's all online and completely confidential. We understand that opioid use disorder is a medical condition and should be treated like one in a protected and judgment-free environment. We meet our patients wherever they are by offering treatment completely remote. You'll be able to see a provider from virtually anywhere through video calls in our app. They can prescribe medication if they decide it's right for you, and will send you everything you need to get treatment in the comfort of your own home. Our treatment costs $199 a month. We're in network with a growing number of insurance providers, and you'll only be charged at the time of your first provider appointment. Don't worry, our enrollment team will help you work through all the details. Bicycle Health Service includes video calls with your provider, online groups, and support from a health coach.
Hear in their own words why they should win.
I'm Ankit Gupta, the CEO and founder of Bicycle Health. We're the leading telemedicine-based treatment provider for opioid use disorder. I started Bicycle Health because we live in a country where over 100,000 individuals lose their lives to opioid addiction every year, and almost 10 million people misuse opioids as well. Despite such high incidence rates, almost 90% of people don't access treatment. And that's due to many barriers like the stigma of addiction, the availability of qualified providers nearby, insurance coverage, confidentiality, and a lot more. And so at Bicycle Health, we deliver a comprehensive care model through our app, which includes medications for addiction treatment or MAT, psychotherapy, recovery coaching, case management and care navigation, at-home drug testing, and a lot more to help patients enter recovery, get better and achieve their goals, and achieve long-term recovery as well. Our mission is to increase access to high-quality, convenient, and confidential opioid use disorder treatment for all. Now, the opioid epidemic has been raging for decades and is only anticipated to get worse. We've seen opioid-related overdose deaths increase by as high as 30% since the start of the COVID pandemic, and yet care options still remain dangerously limited, largely in part due to barriers such as geographic access, cost, and stigma. I wanted to create a platform that addresses those barriers and takes the epidemic head on by offering high quality, confidential, and convenient care for everyone with an opioid use disorder. I think our superpower is creating the best-in-class care model for opioid use disorder and the underlying technology needed to deliver a high-quality care model in a scalable way. Our personalized outcomes-based platform and our evidence-based care model was recently validated in a peer-reviewed publication in the BMJ. I think our care model is thoughtfully built, accessible, and most of all, helps patients find a true path to recovery in an ever-worsening crisis.
My grandfather was an amazing person. As my grandfather started aging, he started to need help. He didn't need traditional home care, he really needed me, but I wasn't always available. So I thought it would be interesting to pair him with a pal. So Papa is a platform that connects older adults and families to what we call pals. They are providing companionship, assistance, transportation, house help. They'll take you to the doctor, they'll help you around the house, they'll show you to use technology, but most importantly, they're there to be your pal.
Hear in their own words why they should win.
I'm Andrew. I founded Papa about 5 years ago. Papa was originally created to help my grandfather. He needed help and assistance and companionship. He really needed me, but I was busy, doing life. And so I thought it'd be interesting to pair him with a fun, energetic, trustworthy, what we now call pals. And so Papa is a platform that connects older people and families to pals for companionship, assistance, and transportation. And then when you think about healthcare, when you're lonely and isolated, it has huge negative effects on your life. In fact, it's equivalent to smoking 15 cigarettes a day, which you can imagine the negative impact that could have on an individual. And 80% of health outcomes are driven by social needs. If you're lonely, isolated, don't have transportation, have housing issues, maybe are food insecure, all of those things affect you negatively. And if we could pair you with a pal, it could really move the needle, and we're happy to do that every day. We see thousands of members on a daily basis. We'll see 1.5 million hours of companionship in 2022, this year, which is 114 years of human connection. And the interactions are pretty powerful and quite nuanced. We've had members go to the beach with pals. We've had members go to weddings. We'd have members that hadn't been to the doctor in years and be able to go and have that in a confident way. But really the goal of what we're doing is trying to reduce loneliness and isolation and other social needs. This really affects people's physical and mental health, and Papa's been able to make a big impact on both physical and mental well-being.
Imagine a medicine made up of pixels and play. Created with cognitive science and proven in clinical studies. A video game
That's what I'm talking about.
that invites your child to discover new worlds,
You did it. Nice.
build their universe,
That creature was tough.
capture mystic creatures, boost past challenges, and unlock new characters.
Oh yeah.
All to create positive change. Introducing Endeavor RX, the first prescription ADHD therapy
Look at us, rocking it again.
delivered through a video game experience. Designed to work alongside your treatment plan
Hey, whoa. You were all round, and I was all woot. Awesome.
and proven to improve attention.
A collaborative care network that empowers more than 1 million providers across the nation. One that equips them with the information, actionable insights, and support to improve whole person care through payer and provider collaboration. That network has arrived. Bamboo Health is revolutionizing healthcare by putting the patient at the center. Built from a powerful suite of solutions, we provide patients, payers, and providers the resources to improve patient outcomes through care collaboration. We bridge the gap between physical and behavioral health, connecting data in an unprecedented way. Whether they're at a hospital, clinic, pharmacy, post-acute center, or behavioral health program, our software notifies providers of real-time patient events and delivers actionable insights to improve patient health at the point of care. Those insights are integrated within the clinical workflow, enabling a patient-centered focus to optimize value-based outcomes and deliver improved patient well-being. With access to near real-time information, providers can quickly address needs, connect patients with resources, and administer support in new and holistic ways.
Hear in their own words why they should win.
As we know, our healthcare system is disjointed and comprises of many manual and inefficient processes. This is abundantly clear when it comes to behavioral health crisis response. The launch of the Behavioral Health Lifeline, akin to 911-988, has shed light on how many states remain unprepared to meet their state's crisis needs. Innovating in this space, we created a crisis management system, which helps coordinate care in behavioral health crisis situations. The solution expedites assessment, tracks a patient's journey from call to treatment, and coordinates all stakeholders within one system. It leverages the OpenBeds platform, which facilitates rapid digital referrals and transfers to behavioral health and substance use treatment. It also fosters collaboration among medical, mental health, and social services providers. Using the crisis management system, call centers can communicate with mobile response teams and treatment providers, see service availability, and dispatch mobile crisis teams when needed. The solution is a closed-loop referral network, meaning all parties can track a patient's journey from start to finish in real time. Further, the system is interoperable with telephony and electronic health record systems for seamless integration. And we've seen states benefit from the use of our solutions. In December 2021, Delaware reached 100,000 referrals for substance use and mental health services on their Delaware Treatment and Referral Network, built on the OpenBeds platform. This means the state had 100,000 opportunities to improve the lives of its citizens. While we're encouraged and excited by the results we've seen at Bamboo Health, we know our work is never done. We continue to innovate and push the boundaries in the behavioral health space. And we look to partners like state governments, providers, payers, and organizations like USCF to help us continue to expand access to behavioral health care. Thank you.
Hey, you made it! Welcome to GridX, your companion in becoming your best self. Whether you're looking to find balance, improve relationships, or just get to know yourself better, GridX is here for you.
Confide in the emotionally intelligent GridX bot anytime. Like a trusted friend, the bot will always be there for you, offering advice, perspective, and compassionate solutions. Anything you say will stay between you and the bot. GridX offers mindfulness tips like breathing exercises, journaling exercises, and even physical exercises.
If you're faced with a tough decision or don't know how you feel, our self-interview can help you discover wisdom and strength you don't even realize you have. We created Grid Expeditions to help you cope with big experiences like anxiety, trauma, and grief. These curated journeys give you the insights, tools, and skills to help you heal and grow.
Browse through our wide-ranging library of tools, tips, and techniques. Save your favorites in your backpack. Wherever you are on your journey of self-discovery, GridX can help you embrace the good times, navigate the bad, and develop grit along the way. Remember, we got this. Together.
Learn to Live is proving that changing your mind can change your life. The online programs teach you the tools and techniques of cognitive behavioral therapy to help you with some of life's biggest hurdles. The self-paced programs are accessible anywhere, anytime. Getting help has never been easier. Simply select a language. Then start with the comprehensive assessment to get a personalized snapshot of your biggest areas of struggle. Choose the program best suited to your needs and register for an account. Your dashboard serves as your home base, where you can access your program, your progress, your data, and other resources. Sign up for Mindfulness Moments, which are weekly text messages with quick mood-boosting tips and exercises. The lessons that make up each program provide a combination of information presented via text, animations, and videos to help you understand the way your mind works, and techniques to help you build new, more thoughtful habits.
Hear in their own words why they should win.
Every day, I have the great privilege of helping people learn to live better lives. And let me tell you how. 1 in 4 Americans face mental health problems, and more than half of them will never receive help. Many of them suffer from stress, anxiety, worry, depression, insomnia, social anxiety, or substance use. But those problems are addressable. I know I was one of those sufferers. And for me, not only is that suffering unconscionable, it's also a call to action. A big part of the problem is that people often don't seek help because of 3 reasons: a lack of available services and providers, high cost, and stigma or a fear of discrimination. While the root causes of these issues are complex, we knew a solution didn't need to be. We founded Learn to Live to overcome these barriers to care and make high-quality mental health services easy to access. We offer self-directed, confidential digital programs and tools based on the clinically proven strategies of cognitive behavioral therapy, known as CBT, and complemented by live clinician coaching for one-on-one personalized support. Our programs and services are available on demand through multiple channels so people can access support when, where, and how they need it. And in order to address the problem at scale and remove the cost barrier, we partner with health plans, employers, universities, and other institutions that are committed to providing mental health support. We work alongside these organizations to effectively engage people in our programs at no cost to the individual. And the results are clear. Learn to Live is now available to over 33 million users across the country. Our programs have a 43% engagement rate. Our users report an average 27% drop in their psychometric score, and 94% of clients would recommend Learn to Live's programs to others. With high user satisfaction and organic growth of over 100x in the last 5 years, I'm happy to report that we are making a real impact to help people learn to live better lives, and we're just getting started.
Let me tell you a little bit about our program. We really built the most clinically informed collegiate mental health program, and we believe that every single student should have some level of support from the day they walk on campus as a freshman all the way through graduation and well after that. We've built a different set of programs that help with that, ranging from a self-guided skills program that's rooted in clinical evidence, all the way through a 24/7 crisis management service to really help in the moment when the student needs it. And between that is our therapy and psychiatry model, which is delivered through a telehealth experience that you can see on the screen. Students can find a provider that works for them. Most of the care is delivered through video visits, although we really also support asynchronously through evidence-based scales as well as messaging. We tend to try to integrate with the campus resources, which is something that we can customize on a campus-by-campus basis. Finally, what's most important in our program is how we think about integrating with on-the-ground operations. And that often means that the counseling center remains an integral part to our partnership. We've built a platform that makes it easier for them to refer students to us and get access to information on that student on an ongoing basis.
Hear in their own words why they should win.
Hi, I'm Ed Gossin, the co-founder and CEO of Mantra Health, the nation's leading digital mental health clinic focused on the treatment of young adults. We're on a mission to make mental health services more accessible and equitable for all 40 million young adults in the United States, many of whom are experiencing high levels of loneliness, anxiety, depression, and other mental health challenges. And we're starting by partnering with colleges and universities. Not having the proper assessment, diagnosis, or treatment can prevent a student from excelling both inside the classroom and outside of it. And it can have tremendous downstream costs to the healthcare systems as a whole. Since the pandemic, campuses have had to evolve their existing services to care for students online and are suffering from the difficulties of having adequate staff on campus. What's more, suicide has become the second leading cause of death for young adults, and in last year, mental health issues have become the leading cause of dropout for colleges and universities. At Mantra, we've built a comprehensive solution that enables campuses to provide care to students throughout all levels of acuity. Each fall, the first day every student who steps on campus at a Mantra partner, our goal is to connect with them where they're currently at, from broadly applicable mental health content to clinical services, to identifying at risk of suicide and escalating them to a crisis line. There's an opportunity for Mantra to improve the trajectory of every young adult's life in a meaningful way through better mental health during university years. Once their trust in Mantra is formed, we have the opportunity to serve them, each of these students, after graduation as they make their way into adulthood through continuity of care. Spanning more than 50 states, our owned and operated provider group of 120 clinicians includes licensed and board-certified therapists, psychiatrists, social workers, and psych NPs, all of whom have been trained in cultural humility and have worked closely with the young adult population. Using evidence-based practices and following the highest national standards of care, our providers are fully prepared to serve diverse student populations and those with high acuity needs. At Mantra, the patient experience comes first. We've built multiple referral pathways, which increases the points of access to care. Our collaboration portal, which is an extension to our proprietary EHR, allows Mantra providers to collaborate clinically with on-campus clinics. This is a unique innovation in the world of digital health, bridging the gap between in-person and virtual care working from different systems. According to a more recent NPS survey, 68% of our patients report that they're performing better in school due to Mantra's telehealth services, and 70% report that our services have helped them stay in school. At Mantra, we want every student, regardless of their ability, background, identity, socioeconomic status, or mental health condition, to have equal access to high-quality mental health care, and we're on our way to making this happen.
Each day, you're asked to log your levels of stress, anxiety, fatigue, and pain. Based on these self-ratings, a daily goal of gameplay is recommended, typically between 6 to 10 minutes. Personal Zen is a simple, casual game that trains you to focus on the positive and let go of the negative. Angry and happy sprites briefly appear and then disappear. Your goal is to trace the trail left by the happy sprite to receive medallions. While watching gameplay, you might notice that your attention draws to the angry sprite instead of the happy sprite. This is called threat bias, a habit of attention that drives you to focus on negative information at the expense of the positive.
Hear in their own words why they should win.
Hi, I'm Raj Amin, CEO and co-founder of Wise Therapeutics, where our mission is to change the game in mental health. The fact is, mental health is facing a massive engagement problem. Although half of us will suffer from a diagnosable mental illness in our lifetimes, only half of those diagnosed will actually seek treatment. This is for a variety of reasons, including stigma, fitting in the time, or the level of effort needed. So how can we help address this engagement problem? In our opinion, we should embrace what's already engaging people every day with the power of mobile gaming. What if we could use this power to treat mental health conditions more easily and effectively? Now, we do this by developing engaging and accessible game-based treatments, ensuring those treatments are supported by rigorous evidence, and offering treatments that are complementary and well integrated into holistic care. Our leadership team brings together clinical research, consumer technology, and healthcare strategy.
I'll start by talking about a cognitive training technique called attention bias modification, or ABM, which is at the heart of our technologies. ABM is digital native and aims to retrain cognitive processes to improve mental health outcomes. My research is focused on evolving ABM to be more engaging and accessible by taking lessons from the world of mobile gaming. We continue to iterate and improve our technology through adaptive algorithms and dynamic gameplay.
Our focus now is to continue achieving clinical and regulatory milestones for our pipeline of digital therapeutics. We have also begun to roll out our deployment platform with payers and providers who embrace the need for new non-pharmaceutical treatment options. At the same time, legislation and industry support has continued to accelerate this new category of products in this important area of software as medicine.
Say hello to Nod, an app designed to empower students to build social connections in college. Think of Nod as a friendly tool designed to help students build the skills they need to navigate the transition from high school to college and create the social life they desire. Nod's content is grounded in behavioral science and the research of loneliness and social connection. Nod is also shaped by input from over 100 students who have firsthand experience.
Hear in their own words why they should win.
3 years ago, we got a call from Hope Lab, a really cool foundation out of San Francisco that's focused on improving adolescent and young adult mental health. They had identified isolation and loneliness as the #1 issue getting in the way of student success. So they saw the work that we were doing. They were really intrigued by the platform that we had in the space. So they partnered with us to take on this issue of loneliness.
We know that Gen Z is the loneliest living generation, and being lonely actually places students at significantly higher risk for anxiety and depression, substance use, suicidal behaviors, as well as dropout.
Now, all of this is before the pandemic.
Back in 2019, 67% of students were saying that they felt very lonely on college campuses. And in light of the pandemic, we've seen those rates increase significantly. I've seen them from 70% on the very low end all the way up to 90%.
We wanted the app interface to be something that was really friendly and engaging, disarming in some ways. But then how do you promote a tool to help somebody deal with being isolated and lonely? How can you put a brand together that is inviting and welcoming? That, I think our team really crushed that work in creating Nod, from the name, the look and feel, the campaign that we put together is really working and resonating with students.
Nod as an app was a finalist for multiple Fast Company awards for design. And we have a randomized control trial on the science side that says students who use this app do indeed decrease symptoms of loneliness, depression, and increase their feelings of campus belonging. We have both the want to use it and the science saying we're delivering on the health outcomes that we set out to do.
So with the success of Nod on college campuses, we thought, well, if we want college students to be better prepared for making friends when they go off to college, perhaps we should take our act further upstream to high school. We've partnered with the Colorado Education Initiative, and we were awarded an Upswing grant to transcreate the NOD experience for high school students.
Lucid Lane's product is called Medication Therapy Management. It is a comprehensive data-driven solution that prevents and reverses dependence on addictive medications like opioids. Our solution is designed to work with physicians in a collaborative care program. It starts with the identification and risk stratification of patients for prolonged opioid dependence. In addition to offering teletherapy delivered by our licensed counselors, our app provides a digital companion experience. It provides remote monitoring of health signals and proactive escalation so that we are always there when our patients need us. Our AI engine examines many health signals, including those provided by patients and licensed counselors. The engine generates a personalized taper recommendation for each patient, enabling a tailored approach for achieving results. Patient health reports and personalized recommendations are delivered to partnering providers via a provider portal. This digital ecosystem creates a truly collaborative medical care environment between therapist, patient, and physician. Our outcomes prove this, with patients experiencing increased quality of life and decreased pain, stress, and anxiety so that they can get back to living their lives.
Hear in their own words why they should win.
Lucid Lane has a huge societal mission about helping people end and prevent reliance on addictive substances.
Anybody who's prescribed an opioid or a benzodiazepine carries risk of falling into persistent use and dependence.
Coming from a small town in southeastern Ohio, I've seen individuals, family members, and communities be destroyed by this, with people really looking for a solution.
Unfortunately, things have been painted as black and white. You're either addicted or you're not. The reality is it's so much more nuanced than that.
And you need a much more integrated solution.
I really believe that Lucid Lane is that solution, a telehealth, digital health company that provides a service that is accessible by anybody.
Tapering isn't just medication management. Lucid Lane provides a personalized, data-driven, and a continuous service to patients when and where they need us. We provide an integrated approach to tapering, which includes CBT sessions, cognitive behavioral therapy sessions to address pain, anxiety, depression, trauma, and other aspects.
We're seeing that we're moving towards a new standard of care. Physicians can now prescribe responsibly and appropriately, knowing that they're giving their patients exactly what they need, prescribing Lucid Lane.
We collaborate and build an alliance with the referring physicians who send us the prescription, but we work together to set the goals for the members that they're referring.
I think Lucid Lane is just really scratching the surface around really solving a bigger problem under behavioral health and mental health.
We've had excellent clinical results in terms of helping patients reduce their dosage, reducing their pain level, improving their anxiety and depression within a few sessions.
I'm Kimberly Cerrone, founder of Teatros. Teatros is a cloud platform that delivers scientifically proven mental health interventions at scale. We use a community-based approach that combines the best of technology with the best of human touch. We begin with a rigorous evidence-based methodology and create compelling programming that clinicians use to engage patients. Our peer-reviewed clinical outcomes are the same as expert in-person psychotherapy, but with deeper, sustained engagement. Our business model is driven by scale. We're now creating solutions for federal customers, large U.S. healthcare providers, large health insurance companies, and leading health and wellness platforms for the education and enterprise markets. Our month-long programs are always priced below the local price cap for a single in-person psychotherapy session. We are currently engaged with scaled partners who collectively cover over 50 million lives. A 1% penetration rate over the next 5 years leads to 50% EBITDA margins and a 10x investor return. But over the next year, we'll grow those partnerships globally to cover over 300 million lives. We're looking for partners and investors who care about effective and affordable behavioral health interventions that meet people where they are when they need help.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.